Ever had that feeling? You know when your dog, who's usually bouncing off the walls, is suddenly just quiet?
Or maybe your cat, usually a bit fussy with food, just stops eating altogether.
Exactly. That little worry in the back of your mind thinking, what's going on here? Well, that's what we're digging into today.
We're going to be exploring canine and feline multiple myeloma. No, it sounds like a mouthful, I know,
It does.
but basically it's a type of cancer involving plasma cells. Those are cells found deep inside the bone marrow.
Right. And even if you're not a vet or technician, the way this disease, multiple myeloma, shows up and how it's diagnosed in pets is, well, it's actually pretty fascinating. It's a real window into how complex diseases work in animals.
We've been looking through some detailed medical reference materials on this.
And honestly, some of the diagnostic criteria are quite surprising. And for dogs, the fact that long remissions are possible, that's really something.
Absolutely. So our mission for this deep dive is to take this complex topic, pull out the really essential information about multiple myeloma in dogs and cats.
And make it understandable, right? Give you some valuable insight.
Exactly. Make it clear and useful.
Okay, let's unpack this then. So, multiple myeloma, what is it in simple terms?
Well, at its core, it's a cancer of plasma cells, specifically those residing in the bone marrow.
Okay.
But the key thing, and this is really important, is that diagnosing it isn't about finding just one single thing.
It's not that simple.
No, it's more like recognizing a pattern, a constellation of findings, you could say. We're looking for things like an increased number of those plasma cells in the bone marrow. That's called bone marrow plasmacytosis.
Right.
Often, we also see specific areas of bone damage, these osteolytic lesions. And then there are specific proteins, myeloma proteins, or the M component, that show up in the blood or sometimes the urine.
So it's finding several of these things together.
Precisely.
Yeah.
That combination points strongly towards multiple myeloma.
That makes sense. Not just one smoking gun, but several clues. So what's actually going wrong inside the body when these plasma cells become cancerous?
So the main problem is these abnormal plasma cells just start multiplying like crazy, out of control.
Okay.
And these rogue cells then start churning out huge amounts of immunoglobulins, or sometimes just pieces of them.
Immunoglobulins, like antibodies.
Exactly, or related proteins. And this overproduction itself causes a whole cascade of other problems. It's quite interesting, actually.
How so?
Well, for one thing, these excess proteins can sometimes sort of link together, making the blood thicker.
Thicker, like literally more viscous.
Yes, exactly. Think of it like syrup getting too concentrated. And this increased thickness, or hyperviscosity, can cause problems with the nervous system, the heart, blood vessels, even breathing.
Wow. Okay, so thicker blood is one issue. What else?
Well, these abnormal proteins can also mess with blood clotting.
Ah, the bleeding issues you mentioned earlier.
Spot on. They can coat the platelets, the little cells needed for clotting, making them less sticky, or they might directly interfere with other clotting factors.
Leading to bleeding gums or nosebleeds.
Potentially, yes. And another big one is kidney damage.
The kidneys too. How?
These excess proteins can get deposited in the kidneys, physically damaging them. Or sometimes the proteins themselves are directly toxic to the kidney cells.
Okay, so kidney issues are common.
They can be, yes. And finally, we often see high calcium levels in the blood, hypercalcemia.
Where does the calcium come from?
It comes from the bones. The myeloma cells can actually stimulate other cells, osteoclasts, to break down bone tissue, releasing calcium into the blood.
Goodness. It really shows how one problem, at the cellular level can ripple outwards and affect so many different systems.
It really does.
So who tends to get this? Is it more dogs or cats? And is there a typical age?
Well, in dogs, the estimates put it at around 1% of all cancers they get. Maybe less than 8% of the hematopoietic cancers, those starting in blood-forming tissues. And about 3.6% of bone tumors turn out to be this.
Okay, so not super common, but significant.
Right. But in cats, it's much rarer, less than 1% of their hematopoietic tumors. So definitely seen more often in dogs.
And age?
Typically older pets. The usual range for diagnosis in both dogs and cats is somewhere between 6 and 13 years old.
So middle-aged to senior pets, generally. Okay. Now, thinking about what an owner might actually see at home, what are the red flags? What signs might suggest a vet visit is needed?
For dogs, the most common things reported are lethargy and weakness. That shows up in something like 62% of cases.
Just seeming tired, not themselves.
Exactly. Lameness, difficulty walking is also pretty common, around 47%. And because of those clotting problems we talked about.
The bleeding.
Yeah. Owners might notice bleeding from the gums or nose epistaxis that's seen in about 37% of dogs with myeloma.
Okay. Lethargy, lameness, bleeding. Anything else common in dogs?
Yes, and this one is quite specific eye changes. Around 35% of affected dogs show unusual things in their eyes. This could be bleeding in the back of the eye, the retina, or even a retinal detachment. Sometimes the blood vessels look kind of twisted or tortuous.
Wow, eye changes too. That's interesting. What about cats? Are their signs similar?
Cats often present a bit differently. Their signs tend to be a bit more general, more vague sometimes.
Like what?
Things like going off their food, anorexia, weight loss, just seeming generally unwell, malaise.
Just ain't doing right, as they say.
Pretty much. Increased thirst polydipsia and increased urination polyuria are also seen quite frequently in cats with multiple myeloma.
So less of the lameness and specific bleeding, more general unwellness and changes in drinking or urinating for cats?
That tends to be the pattern, yes, which, really drives home why paying attention to subtle changes in your cat's routine is so important. Those vague signs can sometimes signal something serious.
Absolutely. Okay, so let's say a vet suspects multiple myeloma based on these signs. How do they confirm it? Are there other diseases they need to rule out first?
Oh, definitely. There's a list of differentials, other conditions that can look similar. In dogs, this could include certain infections like ehrlichiosis or leishmaniasis.
Tick-borne diseases.
Some are, yes. Also, other cancers that might have spread to the bone metastatic lesions. And even things like rheumatoid arthritis.
Okay.
Cats have their own lists too, of course. So to really figure out if it is multiple myeloma, you need a thorough workup, usually involving blood tests, urine tests, and sometimes more specialized lab work.
Okay, let's dive into those tests. What might basic blood work and a urinalysis show in a dog?
Right, so on the complete blood count, the CBC, we often see anemia. Specifically, a non-regenerative anemia, meaning the body isn't making enough new red cells to replace old ones. That's found in about 2/3 of dogs.
Explains the lethargy.
It certainly contributes. We might also see low neutrophils, that's a type of white blood cell in about 1/4 of dogs, and low platelets, thrombocytopenia, in about 1/3, which ties into the bleeding risk.
Okay, CBC shows anemia, maybe low white cells or platelets. What about the chemistry panel?
That's often very revealing. A
Yeah.
key finding is high levels of total protein, specifically the globulin part. We call that hyperglobulinemia.
The proteins produced by the cancer cells.
Exactly. High calcium, hypercalcemia is another important one, seen in maybe 10 to 25% of dogs.
From the bone breakdown.
Correct. And kidney function can be affected too. We might see elevated kidney values, azotemia, in around 1/3 of cases.
And the urine test. What clues might be there?
Urinalysis often shows protein in the urine proteinuria. The kidneys might also lose their ability to concentrate urine properly, leading to isostenuria. And sometimes you see microscopic things like casts or signs of inflammation like pus, blood, or even bacteria if there's a secondary infection.
Wow, quite a lot of potential clues just in the standard labs. What about those more specialized tests you mentioned, like serum protein, electrophoresis? What's that?
Yes, SPE. That's a really crucial one. Think of it like separating all the different types of protein in the blood serum based on their electrical charge and size.
Okay.
In multiple myeloma, because you have this one type of plasma cell multiplying and making tons of just one type of immunoglobulin.
You get a lot of that one protein.
Exactly. So the SPE shows a big, sharp spike in one specific area, usually the beta or gamma region. We call that a monoclonal gammopathy, mono meaning one type.
A single spike.
Right. Occasionally, you might even see two distinct spikes, a biclonal gammopathy, but monoclonal is much more common.
And you mentioned urine tests too, Bence-Jones proteins.
Yes, sometimes parts of these immunoglobulins, these smaller fragments called Bence-Jones proteins, are small enough to leak through the kidneys into the urine. We can test for those specifically using urine protein electrophoresis. They show up in maybe 25 to 40% of dogs with myeloma.
Okay. Any other key lab findings?
Well, reflecting those bleeding tendencies, about half of dogs with myeloma will have some abnormalities on their blood clotting tests.
Right, makes sense. So the lab work paints a pretty detailed picture. What about imaging? X-rays.
Imaging, particularly X-rays, is very important, especially in dogs. Somewhere between 1/4 and 2/3 of dogs with multiple myeloma will show characteristic bone lesions.
The osteolytic lesions?
Yes. often described as multiple sort of punched-out looking holes in the bones, lytic lesions. Or sometimes it's more of a general thinning of the bones, like diffuse osteoporosis.
In cats, you said bone lesions are rarer.
Much rarer in cats, yes. In cats, it's more common to find that the myeloma cells have infiltrated internal organs. The liver, spleen, kidneys, maybe lymph nodes. We sometimes call that myeloma-related disorder with visceral involvement.
So how do you detect that?
Ultrasound becomes really useful there. It can help visualize changes within those abdominal organs.
Okay. So putting it all together, the signs, the lab work, the imaging, how do vets actually make the definitive diagnosis? You mentioned needing a combination of factors.
That's right. For dogs, the generally accepted approach is needing evidence for at least 3 out of 4 main criteria.
3 out of 4. What are the 4?
Okay, the 4 are: 1, that monoclonal gammopathy on the serum protein electrophoresis.
The protein spike.
Yep. 2, those lytic dome lesions seen on x-rays.
The punched out holes.
3, finding Bence-Jones proteins in the urine.
The urine protein fragments.
Correct. And 4, evidence of increased plasma cells in the bone marrow itself specifically, more than 20% plasma cells overall, or more than 5% that look clearly abnormal or malignant when you examine a bone marrow sample.
So you need findings from the blood, the bones, the urine, or the marrow, at least 3 of those pieces.
Pretty much, yes.
Yeah.
That's the classic definition for dogs. But remember, in cats, it can be different, since bone marrow involvement and bone lesions are less common.
The diagnosis might rely more on other things.
Exactly. Often it hinges on finding those malignant plasma cells in biopsies of affected internal organs, along with other supporting evidence like the hyperglobulinemia.
That really highlights the differences between dogs and cats with this disease. Okay, so once the diagnosis is confirmed, what happens next? What are the treatment options?
Well, the first step is often supportive care, especially if the pet is really sick when diagnosed.
Like if they have severe kidney problems or high calcium.
Right, or significant bleeding issues, or maybe a bad secondary infection. Those patients might need to be hospitalized initially for stabilization IV fluids, addressing the calcium, maybe antibiotics.
Okay. What about dealing with that thick blood, the hyperviscosity?
Good question. If hyperviscosity is causing significant symptoms, there's a procedure called plasmapheresis.
How does that work?
It basically involves removing the patient's blood, running it through a machine that separates the plasma, which contains all that excess protein, from the red blood cells.
Yeah.
Then the red cells are returned to the patient along with replacement fluids. It helps lower the protein load quickly.
Like filtering the blood?
In a way, yes. There's also phlebotomy, which is simpler, just removing a calculated amount of blood and replacing the volume with TARV fluids. That can also rapidly, though temporarily, reduce viscosity in critical situations.
Okay, those handle the immediate crises. What about treating the cancer itself long-term?
For the primary cancer treatment, it's really best to consult with a veterinary oncologist. They're the specialists who will be most current on the best protocols.
Makes sense.
And it's important for owners to understand up front that chemotherapy for multiple myeloma in pets is generally considered palliative.
Meaning it's not usually a cure.
Correct. The main goals are to manage the disease, control the symptoms, improve quality of life, and extend lifespan. But the really encouraging thing, especially in dogs, is that long remissions are definitely possible.
So they can feel well for quite a while.
Yes, often for many months, sometimes longer. But realistically, relapse is expected eventually. An oncologist will also discuss potential side effects of chemo, of course.
Are there options besides chemo, like surgery or radiation?
Sometimes. Surgery isn't usually a primary treatment, but it might be considered for, say, a single isolated tumor that isn't responding to chemo, or maybe a bone tumor causing severe pain or risk of fracture.
Okay.
And radiation therapy can be very helpful, mostly for palliative reasons. It can be great for managing bone pain from those osteolytic lesions. It might also be used for spinal cord compression if that occurs, or sometimes to treat larger soft tissue masses related to the myeloma.
So, supportive roles for surgery and radiation. What are the main chemotherapy drugs used?
For dogs, the cornerstone, the standard protocol, usually involves 2 oral medications, melphalan and prednisone.
Melphalan and prednisone.
Right. Sometimes another drug, cyclophosphamide, might be added or occasionally used instead of melphalan, depending on the situation.
And for cats, same drugs.
Pretty much, yes. Melphalan and prednisone, usually given orally, are the mainstays for cats too.
Okay. Are there other medications used alongside chemo?
Yes, particularly for the bone issues. Intravenous drugs called aminobisphosphonate like pamidronate or zoledronate are often used. They help manage high calcium levels and can also reduce bone pain from the lytic lesions.
So they target the bone effects specifically.
They do, yes. And again, an oncologist is the best resource for exact dosages and schedules for all these drugs.
Got it. Are there any major precautions or side effects with those main chemo drugs, melphalan and cyclophosphamide, that owners should know about?
Yes, a couple key things. Melphalan can sometimes cause a delayed drop in platelet count, maybe a few weeks after starting. So monitoring blood counts is crucial to watch for increased bleeding risk.
Delayed thrombocytopenia.
And cyclophosphamide carries a risk of causing something called sterile hemorrhagic cystitis.
Inflammation and bleeding in the bladder.
Exactly. It's not an infection, but an irritation from the drug metabolites. So monitoring urine closely is important if that drug is used. And of course, like most chemo, there's potential for lowering white blood cell counts, which increases infection risk, maybe decreased appetite, occasional vomiting or diarrhea, things like that. Hair loss is less common in pets than people, but possible.
So regular monitoring sounds absolutely critical during treatment. What does that follow-up typically look like?
It is crucial. Follow-up usually involves regular blood tests, CBCs, and chemistry panels, maybe every couple of weeks initially, say for the first 2 months, then often spacing out to monthly or so if things are stable.
Checking blood counts and organ function.
Right. And we also need to track the cancer itself. So repeating that serum protein electrophoresis, the SPE test.
To watch the monoclonal spike.
Exactly. Or monitoring for the Bence-Jones proteins in urine. Those are usually checked monthly until we see a good response, the spike decreasing significantly, and then maybe every 2 to 3 months after that to monitor for relapse.
That gives a clear picture of the treatment journey. So the big question, what's the prognosis? What can owners generally expect?
Well, the good news is that we usually start seeing improvements in how the pet feels, the clinical signs, and those lab abnormalities within the first 3 to 6 weeks of starting treatment.
That's relatively quick.
It can be, yes. Although changes on x-rays, those bone lesions healing, that takes much longer, and they might only ever show partial healing.
Okay, what about survival times?
For dogs treated with the standard melphalan and prednisone protocol, the median survival time is around 18 months.
Median. So half live longer, half shorter.
Correct. And what's really positive is that over 90% of dogs show a good initial response to treatment.
That's a high response rate. Are there factors that predict a shorter survival?
Yes. Some factors seem associated with a poorer prognosis in dogs. These include having very high calcium levels at diagnosis, having very extensive bone destruction visible on x-rays, or having those Bence-Jones proteins detected in the urine.
Okay. And what do dogs with myeloma typically succumb to in the end?
The most common causes of death or reasons for euthanasia are usually kidney failure, developing secondary infections that become unmanageable, or pain from the bone lesions that can no longer be adequately controlled.
That's tough. What about cats? You mentioned their prognosis is less optimistic?
Unfortunately, yes. For cats, the reported median survival times with similar treatments tend to be shorter, generally ranging somewhere between 2 and 9 months.
A significant difference.
It is.
So it really sounds like while multiple myeloma is definitely a serious diagnosis, particularly in cats, there is real hope for management and good quality time, especially for dogs.
Absolutely. And as you said earlier, noticing those early, maybe subtle signs, the lethargy, the slight limp, the increased drinking, and getting them checked out promptly can make a big difference in getting treatment started effectively.
It underlines the importance of knowing your pet and trusting your instincts when something seems off.
Definitely. While getting a diagnosis like multiple myeloma is undoubtedly stressful and concerning, veterinary medicine has come a long way. We have good options now to manage the disease, alleviate suffering, and really focus on maximizing that quality of life for our companions.
So just to quickly recap our deep dive today, we've learned multiple myeloma is this complex cancer of plasma cells in the bone marrow.
Right, and diagnosis isn't simple. It requires putting together clues from clinical signs, blood tests, urine tests, imaging, and sometimes bone marrow analysis.
Treatment, mainly chemotherapy, is usually palliative, aiming for remission and good quality life, with dogs generally having a better outlook than cats.
And the key takeaway, always, is if you're worried about your pet's health, talk to your veterinarian. That's always step one.
Absolutely. You know, thinking about all this, the complexity of diagnosing multiple myeloma, how different signs connect, makes you wonder, doesn't it?
Wonder what?
Well, considering how something like bone pain and kidney problems and eye changes can all link back to this one underlying issue in pets, What other seemingly disconnected symptoms, maybe subtle things we notice in our pets, or even in ourselves, might actually be pointing to a deeper hidden connection?
That's a fascinating thought. It really speaks to the interconnectedness of the body, doesn't it? And how important it is to look beyond the surface symptoms sometimes. Something definitely worth pondering.